Well, Andrew Cuomo's leadership seems to be unravelling by the day after a new report says that the governor prioritised COVID-19 testing for his relatives. Back in the beginning of the pandemic, we can remember that testing for coronavirus was incredibly limited and most countries were struggling to get more. But for the New York governor, it seems the priority of those limited tests was going to his own family. According to the Albany Times, Andrew Cuomo and New York Health Commissioner Howard Zucker directed health officials to prioritise the governor's family in the early days of the outbreak. Those family members included his brother, CNN anchor Chris Cuomo, his mother and at least one of his sisters, the report outlined. Some of the family members were reportedly tested multiple times, with Chris Cuomo receiving an at-home test while the rest of the state struggled with the lack of testing. The governor's administration has denied that the family received this priority testing. Richard Azzopardi, a top advisor to Cuomo, shut down the reports. He wrote in a statement, "In the early days of this pandemic, when there was a heavy emphasis on contact tracing, we were absolutely going above and beyond to get people testing, including in some instances going to people's homes and door-to-door places like New Rochelle to take samples from those believed to have been exposed to COVID in order to identify cases and prevent additional ones. Among those we assisted were members of the general public, including legislators, reporters, state workers and their families who feared they had contracted the virus and had the capability to further spread it." Andrew Cuomo has come under intense scrutiny over both his handling of the nursing home COVID-19 related deaths and after 7 women came forward accusing the governor of sexual harassment.